Hi there, my name is Carly. I'm the founder of Hello Postpartum and the host of our YouTube channel. Today, I'm excited to talk to you all about what you should have at home as a C-section mom. To prepare for postpartum recovery, it is so important to consider that you might have a cesarean birth. Whether your C-section is planned or unplanned, there are some things you need to have at home. Now, personally, I'm a 2-time C-section mom. I know what's important, what doesn't work, what works, and what's really often overlooked. So let me share some of my favorites with you today. Before we dive in, let me just say every postpartum recovery experience is different, and it's important to know before going into recovery or as you're maybe navigating C-section recovery, to know that there is no standardized care plan through the U.S. healthcare system to support the recovery after a cesarean birth. This means there's no insurance-covered physical therapy, there's hardly any checkups with your doctor. You'll maybe have a 2-week incision appointment and possibly, most likely, a 6-week appointment as well. But keep in mind, if you are experiencing any pain, discomfort, discharge from your incision site, any major red flags, you need to seek help from your care provider. If you continue having pain with sex, incontinence, urinary issues, it's important to seek help from a pelvic floor physical therapist. It's important to also note that 1 in 3 births are a cesarean birth. So whether yours is planned or unplanned, I really encourage you to plan for what a C-section recovery could look like, because there is a chance that your birth may end in one too. And it's better to be prepared at least a little bit. So if you haven't already, I definitely recommend checking out our C-section recovery guide. This is an expert written guide that will walk you through everything you need to know about a cesarean delivery and recovery. It is so important to understand what's happening in your body, and this ebook really covers it all. Aside from that, let's talk about some other things you should have at home after your C-section so you can feel super prepared and comfortable. Number 1, lots of pillows. You're going to be using these pillows to prop yourself up, prop your baby up while feeding. Trust me, there's nothing more uncomfortable than trying to feed a baby on a fresh incision site. Like, it is so painful. Pillows can help. If you're breastfeeding, also try the football hold. That's where you kind of tuck baby to the side up on some pillows. They latch this way versus laying cross cradle across your abdomen. You can always work with a lactation consultant if you have questions. Make sure that you're taking your pain medications as prescribed by your care provider. Keep those handy and stay ahead of your pain as much as you can. That means don't wait until the pain is unbearable to take your medications. Take your medications on time, regularly, before the pain is too much. Also, it's important to try to get up and walk as soon as you can once your care provider says it's okay, but also don't walk too much. Avoid stairs, or at least limit them to once a day, depending on what your specific care provider says. I loved also, when I was recovering from my C-section, having really nutrient-dense snacks available on my nightstand, as well as like a huge water bottle filled with electrolytes and ice. That was really helpful. Snacks could look like protein bars, beef jerky, trail mix, some cheese and apples, crackers, anything that's easy for you to grab with one hand and you don't have to move too much to get. It goes without saying that recovery from a C-section is intense. You still will bleed vaginally as your placenta has left a dinner plate size wound on your uterus. So it's really important to honor this time with rest. So we have pillows, we have snacks, we have pain relief medication. You want to have super loose, comfy, stretchy, high-waisted clothes to cover your incision. Along with that, some supportive undies. These are the Postpartum boxer shorts by Davin and Adley. These are great for C-section recovery. They're high-waisted enough to cover your incision. They're stretchy, but also gently supportive too. They kind of offer that gentle upwards pressure versus an inwards pressure, which can actually create downward pressure on your pelvic floor. So these are great. These can be used instead of your traditional postpartum mesh undies. As we're talking about C-section care items, let's also talk about this Peri bottle. We have an entire video on our YouTube channel about how to use a Peri bottle. They are very interesting looking if you've never seen them before, but so helpful, especially for C-section moms. What you'll do when you're finished going to the bathroom, you'll fill this up with warm water. Fill it up before you sit down on the toilet, ideally. Warm or cool water, and you will gently use this to rinse off after you use the bathroom. So you're not bending over and wiping and irritating that incision site. Something else I highly recommend having at home for the early postpartum days would be our C-Heaties. These are instant abdominal heat packs that you can place on your clothes. Sticky side goes on your clothes, and then this gentle heat will provide some relief to your abdomen and your incision site. They are really awesome. They offer hours of relief. They help to improve blood flow, which of course can aid in healing faster. Along with those early postpartum days, I highly recommend an iron boosting tea. Typically more blood is lost during a cesarean birth than a vaginal delivery, so it's important to replete those iron stores, and this iron boosting tea is a great way to do that. I would also recommend for once your incision has healed a bit more and you've gotten the all clear from your doctor, having some of these incision care items on hand so you're not scrambling to find them later on. These C-section mama silicone strips, they're super thin and flexible and durable, and they will help smooth your scar, soften your scar, and create kind of a more even texture, and also help with the elasticity and breaking down of that scar tissue. Help your scar feel more comfortable with time. It's important to give your scar some love. Speaking of scar love, this is also from that same company who makes the silicone strips. This is called a dual, they call it a C-section rock and roller. It looks like a really fancy skincare tool, but it's actually for your incision site. This two-sided tool offers kind of some gentle pressure and sensation in your scar area, because you'll find it's numb, it feels strange, you might feel even disconnected. So using this to gently kind of wake up those nerve endings on your incision is a great way to do just that. And I love that this has this smooth amethyst end, so you could pop this in the freezer and use this cooling side to help calm inflammation around your incision site. It's such a great tool and often something so overlooked in postpartum C-section recovery. And last but not least, this would be a scar balm. This is used to gently massage your scar area to encourage circulation, decrease inflammation, and it is made with certified organic ingredients made by midwives, and it helps to break down scar tissue and improve elasticity of your scar. Sometimes that scar tissue can adhere to different parts of us inside, so breaking down that scar tissue is really important for our mobility, for our overall comfort, and just keeping our scar as healthy as possible after birth. There you have it. If I were going to have a C-section tomorrow, this is what I would have at home, as well as lots of pillows, pain medication, easy to eat food, and lots of water. Another option you could consider is getting a breakfast tray too. I love that idea that you could bring that into bed. Someone could bring it to you. You can have an easy spot to eat your meals and snacks while you recover from birth. I want you to remember that ultimately a C-section is birth, and it is also a major surgery with no standardized recovery plan. So it's so important that you listen to your body, grab our C-section recovery guide so you can have an idea of what's going on in your body after birth. What I missed, tell me in the comments. I'd love to hear from you. Make sure to subscribe to our channel and like this video if you found it helpful. Thanks for watching.